So welcome everybody to the Shift Health and Nature webinar series. This is our chapter 1, the Health and Nature Movement. And we kicked off this webinar series a week ago, and we've, and come to find out that all these changes have happened. And so we've pulled together this special episode to try to help fill in the gap about answering our questions about how nature fits into this bigger picture of the COVID-19 pandemic and what it means to go outside. Just to introduce myself, I'm Erika Virapongzi. I'm a principal scientist at Middle Path Eco Solutions, which is a consulting firm that helps businesses and organizations align better to the needs of their community. I'm also the research scholar and community director for the Ronan Institute for Independent Scholarship, which is an institute that provides a home for researchers and scholars working outside of the typical mortar and brick institutions like universities and federal research labs. I'm a social ecologist. I've worked in domains like conservation and development, traditional medicine and public health, forest management, livelihood strategies, community resilience, social ecological management, scientific data use by the public. And I'm mentioning all this because these themes are really relevant to the scope of Shift and what Shift does and aims to do. And so here I'm pleased to take on the role as the Health and Nature webinar series coordinator. And I've been working really closely with Christian Beckwith from Shift, who I'll introduce in a moment. And we've been developing this webinar series for over the past month. So we're really happy and just excited to bring this product to you. And to just give you a little bit of background about this webinar series and what we aim to do is we aim to bring together these innovators, opinion leaders, and researchers at the forefront of the health and nature movement to help advance our understanding of the public health benefits of time spent outside. And overall, what we want to do is stimulate cross-sectoral learning and promote broader mainstream adoption of the health benefits of contact from the natural world. And we're currently in chapter 1, which was to run through the month of March. And the aim of this is to provide a high-level overview of the opportunities and challenges facing different stakeholders. And we hope to foster cross-sectoral understanding of the connection between health and nature as a first step toward transdisciplinary advancement of the field. And then the subsequent chapters, you'll see that we focus on different sectors, so public health, conservation, land management, outdoor recreation, with this intention to just foster this understanding about what other sectors are doing and how we might engage more. And so, as as I noted, this is a special episode, so this is kind of a little bit outside of what, of our structure, but, it's just so relevant to what it is that we're all thinking about now. So with that, I'd like to introduce Christian Beckwith, who has been my co-developer in this webinar series, and he's the executive director of Shift.
Thank you, Dr. Virapongzi, and welcome everybody I'm sure everybody's talking either from their bedroom or their kitchen or their living room in this new reality. And my name is Christian Beckwith, and I run Shift. We're a nonprofit based in Jackson, Wyoming, that focuses on the advancement and promotion of the health benefits of time outside. And historically, the way that we've done this, and by historically, I mean as of last week, things are shifting a little bit for us as well. We held 2 main events. The first is called the Shift Summit, which is an annual gathering we hold every October here in Jackson, Wyoming. We bring in stakeholders from outdoor recreation, conservation, land management, and public health to discuss issues of importance to all of us. And we also have a program called the Emerging Leaders Program. Dr. Morgan Greene is the director of this program. And this trains early career leaders to help us with our work both at Shift and then in the work that they're doing back in their communities as well. So with last year's Shift, we began to focus in on a couple of other objectives that complemented the programming that we hold traditionally in the fall. One of them was helping researchers develop the evidence base for the health benefits of time outside. And the other was to develop a national narrative around nature as a public health intervention strategy. One of the things that we've been finding is we've been working with all these unbelievable people from around the country who are focused on this nexus of health and nature, is that they're doing such incredible work, but often it's being done in isolation. And very importantly, the story, the language, the avatar, the lexicon that we're all using differs. So we're trying to come up with a coherent storyline for the health benefits of time outside that allow us to promote it more effectively in the public domain. One of the ways that we're doing that is with this Health and Nature webinar series. So we did hold the first one last week. That was with Dr. Michael Sook. That was looking at an overview of the Nature is Medicine movement from his perspective, both as a board trustee with the American Medical Association, and then also as somebody who's been a champion of the health benefits of time outside for a couple of decades now. And this Health and Nature webinar series was really developed initially to help the researchers focus in on the gaps and needs in the evidence base as they do their work. But then simultaneously, it's become a way for us to talk about these health benefits that nature can bring both to our lives and then societally in a way that occupies more of that psychic space in the American demographic. So, as I said, this was all very 2 weeks ago, and we've been working on it for around a month, or even more. I think we began in December, and then the world turned upside down. And one of the great things about the work that we've been doing over the course of the past couple of years is we've been meeting more and more folks in the public health sector who've been focused on public health as a nature as a public health intervention strategy. So it became such an opportunity to have a conversation with them here today in a way that allowed us to address an issue that's on a lot of people's minds, if not everyone's minds right now, and that's the COVID-19 pandemic. So we've asked 3 people who are part of our team to join us here today. Dr. Morgan Greene MD is the director of our Emerging Leaders Program. As I said, he's a pediatric hospitalist at Children's Hospital of Michigan in Detroit. He's a graduate of the 2018 Emerging Leaders Program. He received his medical degree at Loma Linda University, and during his residency at UCSF Benioff Children's Hospital of Oakland, he was a member of UCSF Plus program, which trains pediatric residents to become leaders in advancing health equity. He also worked with the inimitable Dr. Nushin Razani, the founder of the Center for Nature and Health, to develop community engagement models and resident curriculum that connected people to nature. We also have with us here today Dr. Suzanne Bartlett Hackenmiller. She is an OBGYN and integrative medicine physician from Cedar Falls, Iowa, who practices at the Van Dyce Medical Center in Des Moines. Suzanne is one of our board members with SHIFT. She serves as the medical director for the Association of Nature and Forest Therapy and as medical director for All Trails. She's a certified forest therapy guide, and her latest book, The Outdoor Adventurer's Guide to Forest Bathing, was released in July 2019 by Falcon Guides. Welcome, Suzanne. And we have with us David Sabgir. He's the founder and board president of Walk with a Doc. He's also a SHIFT Advisory Council member, so he's been very helpful to us over the course of the last couple of years in the work that we're doing. He practices cardiology full-time for Mount Carmel Health System in Columbus, Ohio, where he serves as their medical director for cardiac rehabilitation. He's board certified by the American Board of Internal Medicine in internal medicine and cardiovascular disease, and by the American Society of Nuclear Cardiology. Walk with the Doc, which he founded, connects patients and physicians outside in order to affect behavior change better than is possible in a clinical setting. And we are very happy to report that Walk with the Doc now has more than 500 chapters worldwide, including Walk with a Future Doc, chapters led by medical students. So this presentation is being recorded for later distribution via the researchers Slack channel, the SHIFT networks, and the distribution channels of our partner organizations. In particular, we would like to thank the National Park Service for being our founding sponsor of the Health and Nature webinar series. So thanks to you all in there in DC. Following this discussion, there will be a question and answer session. Participants are asked to post their questions in the Q&A section at the bottom of your screen. And Erika will be reviewing questions and selecting ones to pose to the panelists following the conclusion of this discussion. So thank you all very much for joining us here today. And so David is with us in spirit, if not in on the video, I believe. David, are you here?
Yes, I'm sorry that the video is not working.
Well, your photo looks wonderful, and we're glad to have you here regardless. So just starting off, suddenly the very front lines of our response to the COVID-19 pandemic is you all. And I have to ask how you're holding up. Morgan, how are you doing there in Detroit?
Yeah, so it's a mixture of kind of relieved to have that time at home, especially with my wife, who's also a doctor. Our schedules align to have more time together now, right? While also very anxious. There's a lot of communication. I'm hearing that burden across healthcare nationally, but there's a lot of communication on how we can be ready for us, particularly at a children's hospital located in the center of an urban area and a lower income population predominantly. How can we be ready for a giant surge? And no one has an answer. So those conversations, as they continue and develop and build up systems, are frequent and concerning. So it's that balance of being available to do what I can do and trying to let go of the things I can't.
Wonderful. Well, thank you for being here with us today, Morgan. And Suzanne, there in Iowa, what do you have to report from the front lines?
Yeah, well, I had today off, so I'm in a much better emotional and physical and mental place than I was last evening. I think after the first 2 days of this week, it's been really heavy. Like Morgan said, I mean, the constant changing, the constant emails. We had to, as physicians in the hospital where I work, drafted a letter on Monday, really pushing for some changes to happen quickly. So it's a very scary, uncharted time for providers. We're all facing frustrations of people not taking this pandemic seriously, and that's something that we're all just struggling with. So I think in the heat of all of this, it's really important to have the conversation about what we can do to take care of ourselves, all healthcare professionals, and that should be part of the conversation. I'm glad that you brought that up.
Yeah, well, it's been an amazing couple of weeks, and suddenly the healthcare providers really are some of the most important people in our societies, and we do want to make sure that you're taking care of yourselves and that we're able to support you in that in whatever way that we can as well. And David, there in Ohio, how are you doing?
I'm doing well, thanks. I think, we're all, it's a special time where we're all experiencing very similar emotions, which doesn't always happen. Both providers, non-providers. Our hospital system just canceled all elective procedures and surgeries, and I'm really proud of the leadership from the governors I'm seeing and at the federal level on preparedness for this. And I would agree with Suzanne. We also need to keep working so we're not another Italy. And I'm seeing the best part of people come out, and that is exciting.
Great. Well, that's great to hear. And we do want to just check in on the current consensus on the response to the coronavirus from within the medical community. So if you could just bring us up to speed on where we are today, that'd be great. And Morgan, would you start us off?
Yeah, I think what's very valuable about this panel, I appreciate that the medical community, we are whole in that we have like similar training, but we're very fragmented. Like what I'm talking about in pediatrics is dramatically different than David with adult cardiology. From a pediatric standpoint, our conversations are really aligning along doing what's best for your patients, doing what's best for yourself as a provider, and doing what's best for our public. And I would say that the 2.5 initiatives I'm seeing brought up most frequently from our national body, like the American Academy of Pediatrics, is focusing on how we can help guide our patients to correct information, how to decrease that stress and anxiety as families' whole worlds are being upended with schools being closed and childcare being a significant problem for so many individuals. So that care for the public, as well as helping to guide on how for this next month, if not more, families can continue to provide the best care they can for their kid, take care of those who are sick, taking care of those who are well, and helping to fall in line is kind of like authoritarian, but how to kind of like abide with what the state by state different restrictions are becoming.
Sort of like obey, as Andre the Giant would say. Suzanne, what do you have to tell us about the current response?
Well, our current struggle is that we're still not able to adequately test where I live and where I work. And so that's just the number one frustration, is we're still under the control of our state hygienic lab and our state Department of Public Health that is still stating that we have to ask patients about travel to the countries of China, South Korea, Italy, and Iran within 14 days. And that is completely irrelevant at this point, since we have documented cases of community spread. I think one of the things that we're trying to get out the message for is this notion that there is asymptomatic spread, especially from children and young adults. And last night I took a walk around the block with my husband, and sure enough, there were groups of families standing out talking and kids playing and shooting hoops. And under normal circumstances, that's wonderful. But we really need to be sticking with our nuclear family right now, the people that we live with. And that's the message that we're just really struggling, I think, to get out, at least where I live. And then that issue of testing, which it's an unbelievable frustration.
Mm. And David, what about there in Columbus?
Yeah, so we have an incredible governor in Mike DeWine, and I was listening to a fantastic podcast, the Daily New York Times. Andrew Cuomo was talking today about the national, unfortunately, the news is not good. He expects the apex in about 45 days, and there's a dramatic shortage in ventilators and beds. And we do have some lead-in calling up the Army Corps of Engineers to make beds other places, but right now medically we are way behind, and I hate sharing that, but we've got a long way to go.
Thank you. This is a hard reality, I think, for all of us. And we do want to pivot here just a little bit to nature and the role that it might be able to play in this particular moment in time. And I'd like to, Suzanne, we've been talking about this over the course of the past few months, well, few years actually, about the role that nature plays in our health. And I just wanted to ask you a little bit about what you've been counseling your patients over the course of the years that you've been doing this, and then how that has changed in the last few weeks.
Yeah. Well, I've been recommending and prescribing nature to my patients for the last 4 or 5 years. And that looks different depending on the patient's reality. And I think that has changed as we've talked in the last few hours, and will continue to change over the next coming weeks. I've had amazing things happen with patients and participants in activities I've led outdoors, whether it's forest bathing or whether it's group mountain biking kinds of things. There's tremendous healing to be found in nature, both mental healing and physical healing. And yeah, over the last few days, we're starting to think about how does that look if we can't congregate with other people, and we're getting mixed signals, I think, from the world. And I think a really important point to make is that right now, if you're in a place that is practicing social distancing but is not having any mandatory lockdown or mandatory stay in your home requirements, which may be coming for all of us, and in some ways I hope they do, but if you're still at the point of social distancing, then there's no reason why people can't sit outside on their porches, why they can't walk around the block with the people in their household. There are really good ways to get outside that are very simple and very safe, and I can't recommend highly enough just being outdoors.
And a couple of the things that you've said, I've really been thinking about a lot lately, which is one of them is the health benefits specifically to our immune systems, being outside. What would you say about that, about nature and its ability to boost our immunity at this point?
Yeah, well, there are studies that look at a number of ways in which being outdoors can boost our immune system. Everything from the phytoncides, which are the little chemicals that we know now are found in plants and have been found to have antibacterial and antiviral and anti-inflammatory and antifungal properties. When we're outside surrounded by trees or close to a plant or a tree, we're inhaling these chemicals, and those have been found to help our immune system. We know that things like spending time outdoors and having the benefit of being in the sun, that the sun gives us vitamin D, and vitamin D helps to boost our immune system. We can go on and on. There are bacteria found in the soil that have been found to boost our immune system by coming into contact with the soil, either through touch or by inhaling the particles of soil. We know that that helps the immune system. We even know that the mental effects of spending time in nature, which numerous studies have found that spending time in nature improves anxiety and depression and overall self-esteem. We know that those things have an impact on our immune system too, because they trigger our relaxation response in the body, and that allows our body to do what it needs to do and our immune system to function properly. So yeah, I could go on and on and on about the benefits of nature on the immune system, but yeah, I'll stop there for now.
Mm-hmm. And it's been such an interesting process, right, of trying to stay on top of all the information as it comes flowing in, and then also to do so in a rational way.
Right.
I think the level of uncertainty has created a distress among a lot of the folks that I'm talking to. And David, you know, with Walk with a Doc, you specifically are bringing doctors and patients outside of the typical clinical visits in order to foster better engagement. And I'm just curious, where do you think the mental and emotional benefits of spending time outside fit into the current situation with coronavirus?
They're more important than ever. This was my, so let me also say we've canceled our walks due to the physical distancing that's required, but we are pushing more than ever to get outside in this time for all the great things Suzanne mentioned: physical, immunity, mental. So I am leading with that with my patients. You know, immunity appears to be the #1 thing on people's minds right now. As I looked at shelter in place and dug around the internet, even the health director in San Francisco, which I've been following the news the last few hours, but with those 7 counties that were in shelter in place, he was still encouraging walking outside, which I was thrilled to see. I also, Cuomo this morning said he is not going to put a shelter in place in, that panic is more significant than the virus. So we're driving home and we're starting a physical distancing challenge where we're going to get as many people outside as we can. It still should be 6 feet, and that's awkward and unnatural and all that. But I think the importance of being outside and promoting that right now is more critical than ever.
And Morgan, you're in Detroit, and it's a different setting than Des Moines, for example, or even Columbus. And I'm just curious, when you're talking to your patients, when you're talking to the parents of the children, how are you talking to them about being outside and how to take care of themselves in nature in this particular moment?
Yeah, so before I won't say hysteria, but all of the emotion and the fear that's going on with coronavirus, the language I would really use is that Detroit's in a very special place, in that within about 15 to 20 minutes, you still have a lot of parks and trails, and they're doing a lot of work in the city itself. And so I encourage people, based on their travel restrictions, how far they can go out and what their vehicles may look like, to really embrace what's within Detroit. There's a lot of bike trails, there's walking trails, there's a river that runs through downtown, and they've kind of put trails on either side. We call it the riverfront. And so you can walk through and still enjoy that. So there's a lot of ways to kind of get outdoors, especially when the weather is permitting. And what I remind families now is, especially like with children, we're seeing that very similarly like with their parents, that as soon as you see something, because we're being inundated with so much information on the news, you jump to like the worst case scenario. And so when people imagine their outdoor response, they see quarantine, because that's what we're hearing from China and Italy, and like that's what I must do, and kind of reminding and bringing back that that's right now not where we are in the United States. Like we are still encouraging, we are still able here in Detroit particularly, because that's where I am, to go out and to enjoy that. And so encouraging them like, oh yeah, they are sharing this in Italy, China, Spain now, but that's not us, and you can leave your house. And so kind of redirecting.
Mm-hmm. We had a couple of questions come in even before this webinar started. One of them was from Ben McHugh with Outdoor Outreach. And he asked, is it prudent to encourage folks to recreate outdoors during this time? It appears that Spain and other countries have prohibited outdoor recreation activities. What activities, if any, would you discourage to limit community spread? Morgan, what would you say to Ben?
I'd say, like, first and foremost, making sure that he's up to date or talking with someone about where he specifically is, because like my situation is different from San Francisco, right? And understanding what their government officials are saying. But from what I understand as of right now, San Francisco area is the most strict in the shelter in place across the nation. And even they are still allowing, like, you can leave the house with your nuclear family unit. If you do meet up with people, as long as it's under 50 or under 10, stand 6 feet apart. And so encouraging that as of now, based on area, the nation does allow for us to encourage going outside, as long as we also bring in that caveat of social distancing. So I would say it's still very prudent, very encouraged, and really helpful as like an anxiety reducer in such difficult times, to encourage people to come outside, and being socially conscious by just always blanketing those messages with the social distancing to show that we are still in solidarity with what the country's trying to do to flatten the curve.
Mm-hmm. And Ben had a follow-on question to that. And he was asking about what specific activities outside you would recommend and which you would not, and the ones that you would not. And Suzanne, what would you say to that?
Well, I guess to echo what Morgan is saying, we can't really recommend going out and playing team sports outdoors. That would go against all of the social distancing recommendations, unfortunately. I can't think of a way in which you could really adequately, I suppose if you were playing tennis or something where you're staying on opposite sides of the court, I mean, perhaps that would be something that's okay. And again, I think we need to remind people that you can do things with the people you live with. The people who live in your house, you can do things outdoors with. You can do whatever you want with them outdoors, I would say. And if Morgan or David disagree with me, speak up. But you know, we can do things with the people that we live with outdoors. Open air spaces have a way of taking the germs away. You know, we're in open air. I wrote an article just last week about this idea of open air and how open air hospitals keep the tuberculosis incidents under control even. So things to think about, that open air is safe. Trees have these built-in properties against germs and things, and there are lots of reasons that being outside is very safe. But as far as what specifically you can do outdoors, I would argue that anybody could do any individual activity outdoors right now. I guess I can't think of anything. I mean, if you're wanting to go to a pool that's currently closed, that would be something that you would not be able to do right now. But as far as outdoor spaces and outdoor activities, do what you normally do. If Morgan or David or Christian or anybody has thoughts on that or thinks otherwise, go for it.
David, what do you have to add?
Yeah, I agree with you 100%, Suzanne. I see Danica wrote on the chat, and I would agree with that. I would even go further to say stay outside as much as possible without getting crazy. But this is the time where we not only need to say it's okay, but we need to push and enhance people to get outside. I would say as long as you are keeping your 6 feet, anything is open for, I can't see any problems with anything.
Mm-hmm.
Thank you. I completely agree, David.
And so, and Suzanne, this is coming back to you a little bit. So from what you've been teaching me about forest therapy, it's an activity that can be done just about anywhere. It's an activity that can be done just about by anyone. And I'm wondering if you could give us a really quick cliff notes on how somebody might incorporate this into their lives at this moment, in particular for the sort of mental and emotional well-being that it can bring.
Absolutely. Well, so as a forest therapy guide, we take participants out on guided walks. That is something that is not advised currently. So as you said, this is absolutely a perfect application for doing it on your own. But forest bathing or forest therapy can be as simple as taking a walk on a trail, taking a walk in a park, taking a walk even at this time, perhaps it's down your city street. But as you do so, make particular effort to notice nature around you. And you can start by just taking some slow, deep breaths and noticing the air that you're breathing in and out through your nose into your lungs, noticing the temperature, the moisture content, things like that of the air. Then starting to notice the fragrances around you. Take some time, a few steps as you walk along, just noticing fragrances. And then maybe shift into noticing what you see and see what colors you notice around you. See what signs of spring, perhaps, if that's applicable to where you live. See what kind of textures you're seeing. Just visually noticing your surroundings, and then noticing the sounds in the air, sounds of birds, sounds of life. You might even start with noticing the sounds from within your body and then taking it out from there. And after you spend some time just walking along in this way, you might notice a shift in your physical symptoms, your mental clarity. I often will start out in that kind of a way, and before I even set foot on a trail, I'll do a kind of a head to toe inventory of my body and my mind, and notice whether I have tension in various places, or a headache, or chest tightness, or notice whether I feel anxious or mind clutter or things like that. And then after 10 or so minutes of walking on the trail in this way, just take another inventory, kind of a body scan, and see where you are. And again, this doesn't have to be walking. So I want to clarify, this could be sitting on your porch and doing these things, looking out at a tree, looking at a vista if you have one. I'm looking out the window as I do this, looking at trees and grass and things like that. So this could be done from indoors even. I mean, I think it's possible to modify these things given our current circumstances in whatever way makes sense right now. Another thing, I'll quickly go on and then I'll yield the floor, but we talk a lot in forest therapy, forest bathing circles about this idea of sit spot. And sit spot is simply just going somewhere outdoors and sitting for 20 minutes with no agenda and just noticing what you notice. And sometimes I set out to do that and I think, oh, I'm not going to notice anything today. And I'm always just amazed at what I notice when I take the time to just sit for 20 minutes outdoors. Journaling afterwards can be really, really effective and profound. And I think that's something that anybody can do right now. Even again, if it means you're doing it from your porch, your balcony, looking out the window, if that's the best you can do. If you can do more, if you can get out to a park or out to the woods or out to the desert or out to a body of water, then do that. But whatever it looks like today, take some time to do it, maybe even schedule it in your calendar.
Mm-hmm. And we had a researchers meeting at SHIFT last year in which Rachel Hopman, who's at Northeastern, presented some research that she'd done on the ability of virtual reality, virtual nature, to lower cortisol levels. And I think with the cortisol levels skyrocketing around the country, even that window can be a benefit, even a view of nature. And we're getting a lot of really good questions here. It's sort of been flowing in as we've been speaking. And Morgan, one of them is quite pertinent to your line of work, and it's asking about playground equipment and what you're talking to to the parents of children about in regard to playgrounds?
Yeah, so in case I was looking over that question in terms of like actual cleaning, that's like not my area, but in terms of playground specifically, it kind of unfortunately does go back in line to what Suzanne was saying earlier. We in the state of Michigan and in many others across the country are, with the social distancing of 6 feet, discouraging a lot of outside of the house interaction, like with different household members outside of 6 feet. And so I'm encouraging families, then again, if they do go outside, the focus really at this point in time is with the parent and their children, that nuclear family. This is not yet the season for the big family gathering or getting together with uncles and aunts' kids, but just really focusing on that nuclear family. And again, I know here in Michigan and in many other states have not banned particular areas of recreation to be accessed as of yet. So if they're open, the state is aware of it, go and use it, but just be careful on how large your party is. But in terms of actual space and locations, if they're open and available, as many still are here, go for it.
Mm-hmm. And actual playground equipment, what about touching and monkey bars, for example, and slides, things like that?
Yeah, so those would still be all right in the sense that what we know of the coronavirus is still to behave outside the body like a lot of other viruses we've been familiar with. So the hand hygiene and the hand washing, it would be super helpful before and after you use equipment, like as usual, don't lick anything, but afterwards with appropriate hand washing would still be fine.
That's great.
That's great.
We've got a
Can
really—
I comment real quick?
Yes.
Thank you, Morgan. That's so good. I've had a lot of people asking about playground equipment, and that's great. Really good advice. I heard a pediatrician on NPR speaking yesterday, and I thought it was really important what she said. And she said, at this time, don't have any children over at your house to play with your children. Don't let your children play at anybody else's house. And again, this is not because we're worried about children getting sick with this disease. It's because that they may not have any symptoms, and yet they may transmit it to older people or people with underlying medical conditions. And one thing that was found in the China studies now after the fact is that it was really the asymptomatic spread that pushed the disease. It was the kids and the people who never had any symptoms that really pushed the disease to the epidemic proportions that it was in China. So that's why we're really, really talking social distancing right now.
Mm-hmm. Well, that's a good segue to a question that we've received from Dr. Terry Horton at Northwestern University. And she asks whether somebody could comment on the negative consequences of social isolation as distinct from social distancing. And David, I'm curious about your thoughts on Terry's question.
Oh, I'm so glad you asked me. Terry, I saw your presentation in Jackson Hole. It was fantastic. And I think this is a really important point. Unfortunately, right now we're dealing with life or death, and social isolation is a critical issue that at Walk with the Doc we're working on all the time to avoid. But right now, I feel like I'm using the term physical distancing instead of social distancing, because I believe that we can still be social. Ideally on Saturday, I could go for a walk with 6, 7 different friends. It's awkward. It's so awkward to stay, 6 feet apart, but walking through the woods with them, as long as we're in our own space, I feel that would go a long way against social isolation and allow us to be together and still keeping that physical distancing.
Mm-hmm. We've got a comment from Bob Ratcliffe there in DC. He's the Director of Conservation and Recreation for the National Park Service, and he announces that the national parks today just announced the parks are free. There's no entrance fees that will be collected for the next few weeks. People are free to use our large open air parks while practicing social distancing, but please don't steal our toilet paper. Thank you, Bob. And this is an interesting segue to a question posed by Tim Peterson, and I believe he is in the Southwest. He says some are taking social distancing to mean an extended vacation in our national parks and monuments. Can you ask your panelists to speak to the danger of inundating rural communities with tourists who may be injured or require healthcare when our small communities' healthcare systems can easily be overwhelmed by local needs as the pandemic worsens? Morgan, what would you say to Tim's comments?
I'd say that as I've been following the news, like as of yet, we have not shut down domestic travel, but most airlines, I can't say all, but most airlines have strongly discouraged non-essential travel, which I would see tourism as. So the country at large is having a lot of conversations. I would not be shocked if by the end of the month something's changed to discourage traveling outside of the country. I know for myself, I had 3 trips in the upcoming weeks that have been canceled. So the country sees you, I would say, rural areas, and those who are concerned about tourism really spreading this disease.
Thank you. Yeah, it's such an important question. I think we live in Jackson, Wyoming, where the entirety of the economy is driven by tourism, and suddenly we're telling people not to come. So this is contributing again to some of that distress and that emotional anxiety and mental anxiety that we're feeling. And David, I'm just curious. Self-care is going to be such an important consideration as we walk through this pandemic in a balanced fashion. And what are you advising your patients in regard to self-care?
Yeah, thank you for that. I think a few things. One, of course, what we're talking about, I do believe being outside and walking is the most important thing. Second, we're advising 7 to 9 hours of sleep. I think, if we don't get sleep, everything else just doesn't work. Those to me are the biggest. And then I try and keep things simple, but if there's capacity, we talk about fruits and vegetables and the importance of maintaining our immunity through those very powerful tools. And then maybe finally, back to Terry's comment, sticking together. We all need each other. And I think that's part of the reason we're having trouble with physical distancing is when times are tough, we, as a species, we want to be together. And this is counterintuitive. So doing what we can to, ideally walk in nature or, video calls or even webinars like this. I think this is great. Social connection, Christian. Those are the things I'm pushing.
Mm-hmm. Thank you, David. We've got a good question from Phyllis. Look, has there been any research yet about transmission of the virus on natural surfaces? So tree bark, flowers, leaves. Suzanne, do you have any insight on that?
I was going to add something to David's comments, but as far as trees, that's just it. Trees and plants naturally have these, properties that don't allow them to transmit disease. So I don't have any concern about wrapping my arms around a tree and catching the coronavirus. Honestly, I think I just don't have that concern. Thanks, Phyllis. Hello.
Morgan, what would you say to Phyllis?
I would add 2 parts to kind of Phyllis' specific question. Like as far as I'm aware, there's only one study that has looked at coronavirus, or COVID, what we're seeing right now out of China. It was just released this week and it was about children. But in terms of the coronavirus class, we have a lot of information on how this virus spreads, and the way we are acting is as though it's like the other type of coronaviruses or similar type viruses like flu and other things that we are more familiar with. And they are usually spread kind of aerosolized, like through cough, and they don't live long outside of hosts. And so as we are anticipating right now, because the research is all still brand new, if it is like the other classes of virus that it comes from, it's unlikely that it can live long outside of human hosts and spread largely through aerosolized or liquid spread, kind of like with coughing is the most common seen one. So it's highly unlikely, unless something brand new is shown, that it behaves like any other virus and is able to affect surfaces outside of human contact.
Thank you, Morgan. We've got a really good question from Tiana Schlattman from Open Lands in Chicago. Is it responsible to be encouraging people to go outside when we don't know how quickly circumstances will change? In making sure we're communicating properly with our network and making sure our messaging is in sync with the public health authorities, do you have any suggestions on how to best communicate this message? David, what do you have to say to Tiana?
It's a really good question, Tiana. And that's why I think I've Googled shelter in place 100 times over the last 3 days. I do not envision anything deeper that would not allow us to go outside and walk. To me, that would be a very significant concern with for all the benefits that we're getting from being outside, let alone being, I don't want to be bugging my wife in the house all day. It's good to get out and have us all, I'd much rather walk with her in the woods. So I do not believe today, and things are changing every day, but I do not envision that there will be a lockdown that would not allow us to get outside. And just personally speaking, if that were to happen, I would be walking around my house looking for cops, and because I feel it's that important.
Mm-hmm. That's great. Again, these questions just keep rolling in, and so many of them are good. Thank you all for sharing them with us. We've got one from Joe Sterncheck. He says, how can we legitimize nature's intervention for health within our current system? And I think in particular with this movement, the restrictions in place that are keeping us inside, I might add to that, how do we elevate the importance of nature in this particular moment? Why don't we give this to Morgan? He looks pensive. He's also looks muted.
I'm trying to understand the question. So legitimizing nature in the midst of a pandemic. Am I interpreting that right?
Yeah. Mm-hmm.
Oh, man. For me, I would love to hear how it is for Suzanne and David. For me, it's continuing to share my message with my patients in the work that I'm doing, and continuing to help dissect the different thought processes going on. Like I was saying earlier, that perception that their country's under a quarantine or a lockdown, and that fear that we can't leave the house, like that's not actively true at this point in time for the United States. And so legitimizing is help at the biggest benefit I see at this time for my patient population is the decreasing in anxiety, decreasing in stress that is mounting with the uncertainty going on, and continuing to promote time outside.
Suzanne, what would you add to what Morgan has to share?
I would argue that as human beings, we've spent most of our evolution in nature. You know, it's only been the last 100 years or so that we've spent so much time indoors. And it's because of our technology and our travel and our airplanes and things that this pandemic has spread as it has. I mean, no time in history has a virus been able to spread so easily, because we move around so much and we are so close to other people so much. So I would argue that this is common sense, that we need to be outdoors, that inherently we know that we need to be outdoors, and that it's being close together in proximity that is contributing to this spread. So as difficult as it is to physically distance, and I like that, David, that's much better than social distancing, we just have to do it. And there's just no reason under the sun that makes any sense as to why we should not be outdoors.
Mm-hmm. Thank you. We've got an interesting one from Jessica Savitch in Vermont. She says, we're about to release guidance for mud season, which is distinctly a Vermont thing, and how to act with social distancing on trails especially. And David, what guidance would you have for Jessica in the state of Vermont that they should include in their guidelines for social distancing on trails?
First of all, great point. I would use this, if I were marketing for you, I would use this as a very special opportunity to get out. To get back quickly to the last question, when Pokemon Go was out 2-3 years ago, you couldn't get a parking space at our park. So while this is horrific and we're all being shocked every hour, in our neighborhood, my wife Kristen and I, there are more people out walking than there have been in the 15 years that we've lived there. And we're just at the start of that. So I think it's just going to happen naturally. No pun intended. People are going to get outside. Back to the mud season. I love keeping things simple. And I would say you need this now more than ever. Just practice physical distancing of 6 feet and go have at it.
Thank you. We've got one from, let's see, Gloria Orozco. What kind of content or activities do you recommend to help families deal with being inside that could encourage the use of natural areas? Do you have any potential resources that you might share with parents who are having a lot of quality time with their children these days?
Yes, I'll just add two. So Children in Nature Network, I believe a week ago, came out with 10 things to do with your families, and it ranges from things outside like gardening, staying in your own yard, and inside for those who may be more ill or were traveling outside, may not be as accessible, looking out windows and such. And so Children Nature Network, I know, has like a top 10 things to do, and I'd look towards that. And then the American Academy of Pediatrics has a website specifically on taking care of children. It's on healthychildren.org, how to take care of your children in light of all of this new time together that we have at home. And it gives a lot of recommendations, not only in what we can do with our children, but also how to talk to them about what's going on in the country.
Thank you. We got a question from Karen, and it simply says resources and articles on the effect of nature on immunity. And I think what we might be able to share, Suzanne, is the article that you wrote recently about just that. That has some references to it, so we can share it.
Yeah, I wrote an article just a week or so ago that I published on my personal website, which is integrativeinitiative.com. I've actually written 2 articles on the topic in the last 10 days or so, but one talks specifically about the immune system and things that we can do from all kinds of different things, including the things that David mentioned: nutrition, exercise, sleep, but also a number of reasons that nature can help boost the immune system. And I did reference studies in that article. So if you're interested, it's at integrativeinitiative.com.
And we've got Dr. Vera Pongzia coming online, which means that we're approaching the end of our webinar. And Erika, we can include this in the resources when we post this webinar on YouTube. Is that correct?
Yes, we can do that. Yeah, I'm definitely keeping track of the questions that have been asked, and also this commentary. So we will be following up on that.
Wonderful. And I'm going to just close with one question, because this is, it's the one thing that continues to come up again and again. Where are you directing people to get reliable information about the coronavirus? And Dr. Sabgir, what would you say to that?
WHO, there's incredible leadership there. Of course, you'll want to pay attention to our local, state, and federal officials with their recommendations, but WHO is doing a bang-up job.
Mm-hmm.
And CDC, so WHO is the World Health Organization for their website, and CDC is the Center for Disease Control. Major difference I've been seeing is that the CDC focuses more on what's going on a national level. If that's information you're looking for, what states have been affected, what numbers, what implementations are taking place, where WHO is giving the global picture.
Thank you. Suzanne?
I would agree. I've been looking at both sites on a daily basis. And then, yes, your local public Department of Health also has information.
Thank you all so much for joining us today. Dr. Vera Pongzia, would you like to wrap it up?
I sure would. Just share the screen. So yeah, thank you so much for this great panel. I mean, this has been, I think, answered a lot of my questions. We've all been wondering, what we can do and can't do. There are just so many mixed messages out there. And SHIFT is has such a great community and such a great source of experts and resources who can really help us figure out, what is good information and what isn't, such great information. So, I think this is a really important role that SHIFT can play in all of this, and giving us all kind of reassurance is what we what we can do, because I don't think anyone's looking forward to just sitting in their house, in their room for the next, unforeseen future. So, we can get outside. I think that's the main message. There are ways to do it. There are good ways to do it. And I think we can look towards this community as being a source of inspiration and also support, and support each other. I think that's the most important thing. Just having a community and having people we can turn to ask questions and reflect with, I think is just so key and so important here. And so to that end, I did note, I have been taking, we can record all of these notes, we have them, and we're going to follow up. And we have a Slack community to continue this discussion. I'm just going to put that, since you can't obviously click on a link, the links are here. And so you can just save that. That's our Slack community. There's a health and nature channel, if you're used to using Slack, that you can go to. And you can get the webinar recording. It's going to be on the YouTube, Slack, YouTube, Shift YouTube. And then the slide decks will always be on Figshare. And we are going to have another webinar next week from Linda Wang from the Trust for Public Land, who will be giving us a perspective about health and nature from a land management and land trust perspective. And then also some Shift announcements, that the Emerging Leaders Program is accepting applications, and Morgan is leading that, so you can reach out to him. And then also please do send us nominations for the Shift Awards, and you can send an email to Arian for that. And with that, we would like to close this webinar, and we are so glad to see you all here. We hope that you'll continue to join us in this webinar series, that, it's a great place for us to connect, and just stay in touch, hang in there, and get outside. So take care, everybody.
Thank you.